My name is Kyle Goetti, and I am the nurse clinician for the Amputee Rehabilitation Program here at Parkwood Hospital in London, Ontario, part of St. Joseph's Healthcare. It is unlikely that we will ever have to meet with me in the role as your nurse clinician in this program. But the reality is that of the relatively small numbers of people in society who suffer an amputation of a lower limb, 70 to 80% live with diabetes. Half of that 80% will have a second amputation within 2 to 5 years of the first. Having said that, the American Diabetes Association estimates that over half of the amputations related to diabetes are preventable. That makes understanding and practicing good foot care an important part of living with diabetes. One of the possible side effects of diabetes is diabetic neuropathy. This term is used to describe the lack of feeling or sensation that some people living with diabetes can start to experience, particularly in their hands and feet. This effect can make it very difficult for someone to know when their foot is experiencing harm through too much pressure or extreme temperatures. We call this effect the loss of protective sensation. There's a quick, reliable, painless test that your doctor or health professional can perform on your feet that will give you a reliable indication as to whether or not you are suffering this loss of protective sensation. It is called a 10-gram monofilament test, or a Semmes-Weinstein test. It involves the use of a thin plastic wire, much like fishing line, that is pushed against the bottom of each of your bare feet in 9 locations, just like this, and 1 more location on the top of each foot. With your eyes closed, you say out loud if and when you feel the pressure from the wire. Every time you feel the monofilament where it touches your skin, it is recorded as a positive sign. A positive score of 6 or less out of 10 means that you are suffering from loss of protective sensation, and means that your foot will be at high risk for suffering a wound. This test should be performed annually, but more often if either foot scores 6 out of 10 or less. This loss of protective sensation makes it essential that you get into the habit of giving yourself good foot care. A good way to learn proper foot care technique is to watch an actual demonstration. The items include skin moisturizer, a large handheld mirror, soap, washcloth and towel. It is important to mention that not all soaps are the same. You want to use one that cleans but is gentle to your skin. Perfumed and deodorant soaps can be particularly harsh on the skin and should be avoided. It would be a good idea to ask your health professional for particular product suggestions to best meet the needs of your own skin. The water for the wash can be warm but never hot. The loss of protective sensation that we talked about earlier can slowly affect your hands, possibly making them unreliable to sense a safe water temperature. This can make burns to your fingers or toes a real possibility. Our model Travis is using his elbow as an easy way to check if the temperature is safe. If you're using a thermometer, a temperature between 32 and 40 degrees Celsius would be considered a warm bath water. Temperature of the water is very important. In fact, as our patients pass through our program, we give them these free safety thermometers. Once placed in the water, they will light up depending on the temperature. The far left will light up red and say too hot. The far right will light up and say cold. Or what we want is the middle one to light up green and it will say okay. It is a simple but useful way of making sure that the temperature of the water is safe. Similar products can be available through your pharmacy. Travis begins by lathering his washcloth and washing his foot. He's making sure that he gets to all areas of his foot. As Travis finishes his soapy wash and continues on to rinsing with water, it is extremely important that you get right in between the toes. You must also check your toenails while washing your feet. Your toenails should be cut straight across with a proper nail clipper. The foot inspection occurs during the entire washing, rinsing, and drying procedure, but it is essential that at the end of the drying, and again making sure that you get right between the toes, that you use a large handheld mirror to look at all areas of the foot. A mirror such as this one can be purchased at any drugstore and most dollar stores. During your washing, drying, and visual inspection, If you find a change in the appearance of your skin, it could be a black or a red mark that may or may not be broken open. Do not soak it. It used to be believed that soaking a wound would speed up healing, but all you're really doing is creating a large bacteria soup that likely will lead to a nasty infection. Instead, go see your health professional as soon as possible to have the area treated and the problem corrected. The next step is to make sure that you apply a small amount of skin moisturizer to your feet, being careful not to get it in between your toes or on any breaks in the skin or sores found during the inspection. If the moisturizer gets in between the toes or on a wound, there's a good chance of having the skin break down and getting an infection. Give the lotion a chance to be absorbed into your skin before putting your socks on. Some people perspire a lot between their toes and find comfort by applying a small amount of powder there. Having completed the foot care, it is now important to pause a moment before putting on your footwear. Always check the inside of your socks and shoes before you put them on. It is amazing how often things such as a nail, tack, stone, or paperclip will find their way into the sock or a shoe. The pressure created by these items can be the starting point for a bad foot wound. Many of the people that I've looked after in our amputee rehabilitation program described having a foot wound for some time without realizing it. By the time they did realize it, the wound had become very serious and eventually led to their amputation. On display are a sample of footwear that would be safe choices for people living with diabetes, depending on their individual needs. You need to make sure that your shoes have lots of room for your toes, so that your toes aren't being pinched by inside seams. Pointed shoes put too much pressure on your toes, and open-toed shoes or sandals don't offer any protection at all. This pair of runners, much like other runners on the market, have stitch work on the outside of the shoe around the toe box. Is common on many varieties of shoes. But if we reach inside the shoe itself and feel along where the stitch work is, I can tell that this shoe is safe for someone with diabetes. I cannot feel any of that stitch work coming through. Nothing to cause pressure points on someone's toes. This next pair of shoes is meant to demonstrate what a wide toe box looks like. It's not pointed, so it gives your toes lots of room to move inside the shoe. The other nice thing about this is that it shows that there aren't any stitch working on the outside of the toes, which means that there aren't any pressure points inside to give your toes difficulties. Finally, this last pair of shoes is much like the other pair that I just showed you. This shoe, like the previous shoe, has a wide toe box, not pointed at all. It's also smooth. There are no seams in there to cause pressure points. But it is also extra depth, which means that it can accommodate people whose toes may need extra room. It is also extra depth to accommodate people who may have to use orthotics inside their shoe. Footwear should not be limited to outside the home. It's just as important to protect your feet while in your home. If you have a loss of protective sensation and/or you have been prescribed orthotics, wearing slippers in the home is not an option. Shoes and orthotics are for your safety and benefit. They do not provide either if they're not being worn. You should be wearing your shoes at all times, even if it means having to go through the trouble of keeping one pair for outdoors and one pair for indoors. Please remember to switch your orthotics into whatever shoes you plan on wearing. When shopping for shoes, it is important to go to a reputable business with experience in fitting shoes on people living with diabetes. The importance of good foot care and proper footwear cannot be emphasized enough. In fact, one study found that 84% of diabetic foot wounds started from poorly fitting shoes, socks, pressure on the foot, poor nail care, and hitting the foot against something. Many of the people that I have helped look after who have suffered an amputation of their leg described having a foot wound for some time before they even realized it and sought help from a healthcare professional. We realize that not everyone has the physical ability or the eyesight necessary to wash and examine their feet as demonstrated in this video. But whether it's you, a loved one, friend, or caregiver, someone needs to give your feet this care on a daily basis. In closing, I would like to offer you some final words of advice. Get into the habit of eating a healthy diet. Check your blood sugars as directed. Take your medications as prescribed. Participate in activities that you enjoy. And get into the habit of preventative foot care now, if you haven't already. and it is likely that we will never have to meet.